Question 1. What is the very first step you should take when you see someone collapse or find someone unresponsive? A. Begin chest compressions. B. Call 911 or the local emergency number. C. Check for breathing. D. Ensure the scene is safe for you and the victim. Answer: D. Ensure the scene is safe for you and the victim. This question tests your understanding of the absolute first action in any emergency situation. The keyword very first step emphasizes that your safety, and the victim's, must be secured before attempting any care. Always scan the environment for hazards like traffic, fire, or live wires because you cannot help others if you become injured yourself. For example, if someone collapses in the middle of a road, your first thought should be to protect them and yourself from traffic before approaching. Remember, scene safety is the foundation of all emergency care. Question 2. For an adult victim, what is the correct hand placement for high-quality chest compressions? A. On the upper half of the breastbone. B. On the lower half of the breastbone, sternum, centered between the nipples. C. On the ribs directly under the armpit. D. Anywhere on the chest as long as it feels firm. Answer: B. On the lower half of the breastbone, sternum, centered between the nipples. This question assesses your knowledge of the precise anatomical location for effective adult chest compressions. The keyword correct hand placement is crucial for ensuring that compressions are delivered directly over the heart. Placing the heel of one hand on the lower half of the breastbone, sternum, with the other hand on top, maximizes force transfer to the heart and minimizes the risk of injury to other organs. For example, imagine drawing an imaginary line between the victim's nipples and placing your hands just below the center of that line. Proper hand placement helps you effectively circulate blood to vital organs. Question 3. What is the recommended chest compression depth for adult CPR? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters. D. No more than 2 inches 5 centimeters. Answer: C. At least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters. This question focuses on a critical aspect of high-quality adult CPR, the correct compression depth. The recommended compression depth is vital because it ensures enough blood is pumped to the brain and other vital organs. For adults, compress the chest at least 2 inches 5 centimeters deep, but not exceeding 2.4 inches 6 centimeters to maximize effectiveness without causing unnecessary injury. Imagine pushing down about 1/3 the depth of the chest to achieve optimal blood flow. Remember, push hard means pushing deep enough to make a difference. Question 4. What is the correct rate for chest compressions for adults, children, and infants? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. Answer: C. 100 to 120 compressions per minute. This question tests your knowledge of the universal compression rate for CPR across all age groups. The correct rate is essential for maintaining consistent blood flow during CPR. The American Heart Association recommends a rate of 100 to 120 compressions per minute for adults, children, and infants. A good way to keep rhythm is to compress to the beat of a familiar song like "Stayin' Alive" by the Bee Gees. Always remember, push fast means maintaining this specific range for optimal blood flow. Question 5. How many chest compressions and breaths should be given in one cycle of single rescuer adult CPR? A. 15 compressions to 2 breaths. B. 30 compressions to 2 breaths. C. 30 compressions to 5 breaths. D. 5 compressions to 1 breath. Answer, B. 30 compressions to 2 breaths. This question assesses your knowledge of the standard compression-to-breath ratio for single rescuer adult CPR. The phrase single rescuer adult CPR is key, as ratios can differ for other age groups or with multiple rescuers. The standard guideline is to deliver 30 chest compressions followed by 2 rescue breaths, repeating this cycle to balance continuous blood flow with oxygen delivery. For example, after 30 rapid compressions, you would quickly deliver 2 breaths before immediately resuming compressions. Always strive for minimal interruptions during this sequence. Question 6. What should you do immediately after delivering a shock with an AED? A. Check for a pulse and breathing. B. Continue with chest compressions immediately. C. Turn off the AED. D. Reposition the AED pads. Answer, B. Continue with chest compressions immediately. This question focuses on the crucial action directly following an AED shock. The keyword immediately after delivering a shock emphasizes that there should be no delay in resuming life-saving measures. Regardless of whether the victim responds, the most important next step is to immediately resume high-quality chest compressions for approximately 2 minutes, or 5 cycles. This helps circulate blood that may have been stagnant and maintains blood flow to vital organs. For instance, once the AED announces shock delivered, you would place your hands back on the chest and restart compressions without hesitation. Remember, every second of compression counts. Question 7. When checking for responsiveness in an adult, what should you do? A. Shout for help and then immediately call 911. B. Gently tap the victim's shoulder and shout, "Are you okay?" C. Pinch the victim's earlobe firmly. D. Shake the victim vigorously. Answer, B. Gently tap the victim's shoulder and shout, "Are you okay?" This question tests the correct method for assessing an adult's responsiveness. The action of gently tapping the victim's shoulder and shouting, "Are you okay?" is the recommended and safest way to try to get a response. This helps determine if the person is truly unresponsive, which then guides your subsequent emergency actions. For example, if you see someone slumped over, you would approach cautiously, then tap and speak loudly to see if they react. Always remember to be gentle yet firm enough to elicit a response without causing harm. Question 8. What does AED stand for? A. Automated emergency device. B. Advanced external defibrillator. C. Automatic external defibrillator. D. Assured electrical device. Answer, C. Automatic external defibrillator. This question tests your basic knowledge of the crucial acronym AED. Understanding what AED stands for is fundamental because it refers to a portable electronic device designed to save lives during sudden cardiac arrest. An automatic external defibrillator, AED, automatically diagnoses life-threatening cardiac arrhythmias, irregular heartbeats, and can treat them by delivering a dose of electricity to reset the heart. For example, when you see a wall-mounted AED in a public place, you now know its full name and primary function. Knowing this term helps you understand its purpose, a device that can automatically deliver a life-saving shock. Question 9. What is an agonal gasp, and what does it indicate? A. It is normal breathing and indicates the person is recovering. B. It is a sign of mild choking and indicates the person needs help clearing their airway. C. It is a sign of cardiac arrest and indicates the person needs CPR. D. It is a sign of an allergic reaction and indicates the person needs an epinephrine autoinjector. Answer, C. It is a sign of cardiac arrest and indicates the person needs CPR. This question assesses your ability to recognize a critical sign of cardiac arrest. An agonal gasp is a distinct, ineffective breathing pattern characterized by gasping, snorting, or gurgling sounds that may look or sound like breathing but are actually signs the heart has stopped. These are not normal breaths and are a strong indicator that the person is in cardiac arrest and requires immediate CPR. For example, if someone collapses and makes occasional, noisy, ineffective gasps, treat it as a lack of normal breathing and start CPR. Remember, if breathing isn't normal, begin CPR. Question 10. When should you stop CPR once you have started? A. When the victim starts breathing normally. B. When you are too exhausted to continue. C. When another trained rescuer takes over. D. All of the above. Answer: D. All of the above. This question tests your knowledge of the appropriate conditions for discontinuing CPR. Once initiated, CPR should be continued until one of these definitive criteria is met. The victim clearly starts breathing normally and shows other signs of life. Another trained rescuer, such as EMS personnel, arrives and takes over, or you become too physically exhausted to continue providing high-quality compressions. For instance, if paramedics arrive, they will relieve you and take over care. Always remember, CPR is a physically demanding task, and these are the only situations where it is appropriate to stop. Question 11. What is the purpose of chest compressions during CPR? A. To stimulate the heart to start beating on its own. B. To circulate blood to the brain and other vital organs. C. To clear an obstructed airway. D. To inflate the lungs with air. Answer: B. To circulate blood to the brain and other vital organs. This question focuses on the primary physiological goal of chest compressions during CPR. The purpose of chest compressions directs you to their fundamental role in sustaining life. Chest compressions manually pump blood from the heart to the brain and other essential organs when the heart is unable to do so effectively on its own. This action provides temporary blood flow, keeping cells alive until the heart can be restarted or professional help arrives. Imagine compressions as manually squeezing the heart to keep vital oxygen flowing throughout the body. Remember, good compressions buy time for the victim. Question 12. For an adult choking victim who is conscious and cannot speak or cough, what is the recommended first aid? A. Lie them down and begin chest compressions. B. Give 5 back blows followed by 5 abdominal thrusts. C. Give 5 chest thrusts followed by 5 abdominal thrusts. D. Encourage them to cough harder. Answer: B. Give 5 back blows followed by 5 abdominal thrusts. This question tests your knowledge of how to respond to a conscious adult who is choking. The keywords conscious and cannot speak or cough indicate a severe airway obstruction requiring immediate intervention. For a conscious adult choking victim, the recommended first aid is to deliver 5 back blows between the shoulder blades, followed by 5 abdominal thrusts, Heimlich maneuver, continuously alternating until the object is expelled or the person becomes unresponsive. For example, if someone clutches their throat at dinner, you would perform these maneuvers to dislodge the food. Remember, act quickly and decisively in a choking emergency. Question 13. How long should you check for breathing and a pulse in an unresponsive person? A. No more than 5 seconds. B. At least 10 seconds but no more than 30 seconds. C. At least 5 seconds but no more than 10 seconds. D. At least 30 seconds. Answer: C. At least 5 seconds but no more than 10 seconds. This question assesses the appropriate time frame for checking vital signs in an unresponsive individual. The phrase, "How long should you check?" emphasizes the importance of a quick yet accurate assessment. When checking for breathing and a pulse, you should take at least 5 seconds but no more than 10 seconds to determine if normal breathing is present and if a pulse can be felt. This brief window prevents unnecessary delays in starting CPR if it's needed. For instance, After checking responsiveness, you would quickly look for chest rise and feel for a pulse on the neck for no more than 10 seconds. Remember, time is critical in an emergency, so a rapid assessment is essential. Question 14. When giving breaths during CPR, how should you open the airway of an adult? A. Head tilt, chin lift. B. Jaw thrust without head tilt. C. Neck extension. D. Side-lying recovery position. Answer: A. Head tilt, chin lift. This question focuses on the correct technique for opening an adult's airway during CPR. The head tilt, chin lift maneuver is the standard method used to move the tongue away from the back of the throat, which is the most common cause of airway obstruction in an unresponsive person without a suspected spinal injury. This technique gently tilts the head back while lifting the chin, creating an open passage for air. For example, after performing chest compressions, you would use this maneuver to prepare for delivering rescue breaths. Remember, a clear airway is essential for effective rescue breathing. Question 15. What is the most common cause of cardiac arrest in children and infants? A. Heart attack. B. Stroke. C. Respiratory arrest, breathing problems. D. Sudden cardiac death. Answer: C. Respiratory arrest, breathing problems. This question assesses your understanding of the primary difference in causes of cardiac arrest between adults and children/infants. The keyword most common cause is crucial here. Unlike adults, where cardiac arrest is often caused by a sudden heart problem, in children and infants, it typically results from respiratory arrest, breathing problems, or shock that leads to respiratory failure. This means their heart often stops because they can't breathe properly. For instance, choking, asthma attacks, or severe infections are common causes of breathing issues that can lead to cardiac arrest in young ones. Remember, for children, focus on preventing breathing problems from escalating. Question 16. How do you assess for normal breathing in an unresponsive adult? A. Look, listen, and feel for no more than 10 seconds. B. Look for chest rise and fall for at least 30 seconds. C. Listen for breath sounds for at least 15 seconds. D. Feel for air movement from the mouth for 5 seconds. Answer: A. Look, listen, and feel for no more than 10 seconds. This question tests your ability to quickly and effectively assess for breathing. The phrase "assess for normal breathing" is key, emphasizing a rapid but thorough check. You should look for chest rise and fall, listen for breath sounds, and feel for air movement from the victim's mouth and nose for a period of at least 5 but no more than 10 seconds. This comprehensive approach helps determine if the person is breathing normally or requires immediate intervention. For example, after checking responsiveness, you would quickly look at their chest and put your ear near their mouth for a brief moment. Remember to be quick but thorough when checking for breathing. Question 17. Where should AED pads be placed on an adult? A. Both pads on the upper right side of the chest. B. One pad on the upper right chest and the other on the lower left side of the rib cage. C. Both pads on the left side of the chest. D. One pad on the back and one on the chest. Answer: B. One pad on the upper right chest and the other on the lower left side of the rib cage. This question focuses on the correct anatomical placement of AED pads for an adult. Proper AED pad placement is essential for the device to effectively deliver an electrical shock across the heart. One pad should be placed on the upper right side of the chest, above the nipple, and the other pad should be placed on the lower left side of the rib cage, below the armpit. This specific positioning ensures the electrical current passes through the heart. Imagine the current flowing in a diagonal line through the heart. Correct placement maximizes the chances of a successful defibrillation. Question 18. What is the recommended method for opening the airway of an infant? A. head tilt, chin lift, but only to a neutral or sniffing position. B. Head tilt, chin lift with a strong head extension. C. Jaw thrust without head tilt. D. Turn the infant onto their side. Answer: A. Head tilt, chin lift, but only to a neutral or sniffing position. This question specifically addresses the correct airway management technique for an infant. The keyword infant is crucial because their anatomy requires a gentler approach. For an infant, use the head tilt, chin lift maneuver, but only tilt the head back to a neutral or sniffing position, meaning their nose appears to be sniffing the air. Overextending an infant's neck can actually close their airway due to their softer trachea. Imagine gently lifting their chin just enough to align their airway for breathing. Gentle handling is key when opening an infant's airway. Question 19. When should you call 911 or your local emergency number if you are alone with an unresponsive adult? A. After performing 2 minutes of CPR. B. Immediately after determining the person is unresponsive and not breathing / only gasping. C. After retrieving an AED. D. Only if there are other bystanders present. Answer: B. Immediately after determining the person is unresponsive and not breathing / only gasping. This question tests your understanding of the critical timing for activating the emergency response system for an adult. The core concept is call first, fast for adults in these scenarios. Once you've ensured scene safety and quickly determined an adult is unresponsive and not breathing normally, or only gasping, the very next step is to call 911, or the local emergency number, to get professional help en route as soon as possible. For instance, if you find an adult suddenly unconscious, you would shout for help, tap their shoulder, and if no response, immediately call for help. Early activation significantly increases the chances of survival for an unresponsive adult. Question 20. What is the first thing you should do after recognizing a child or infant is unresponsive and you are alone? A. Start chest compressions immediately. B. Give 5 rescue breaths. C. Call 911. D. Perform 2 minutes of CPR, then call 911. Answer: D. Perform 2 minutes of CPR, then call 911. This question focuses on the care-first approach for lone rescuers with children or infants. The keywords child or infant and alone are critical here. For children and infants who are unresponsive and not breathing, and you are the only rescuer, it's recommended to perform approximately 2 minutes, about 5 cycles, of CPR first before calling 911. This prioritizes immediate oxygen delivery, which is often what these young victims need most. For example, if you find an unresponsive child, you would immediately begin CPR for 2 minutes, then stop to call for help. Remember, for children and infants, provide care first when alone. Question 21. What should you do if an adult choking victim becomes unresponsive? A. Continue abdominal thrusts. B. Position them on their side and call 911. C. Begin CPR, starting with chest compressions. D. Check for a pulse. Answer: C. Begin CPR, starting with chest compressions. This question assesses your knowledge of how to manage a choking emergency that escalates to unresponsiveness. The key phrase, becomes unresponsive, signals a shift from conscious choking maneuvers to full CPR. If a choking victim becomes unresponsive, you should immediately lower them to the ground and begin CPR, starting with chest compressions. Each time you open the airway to give breaths, look for the obstructing object and remove it if seen. For example, if someone collapses after you've given back blows and abdominal thrusts, you would immediately transition to chest compressions. Always remember that chest compressions can help dislodge the object. Question 22. During true rescuer CPR on an infant, what is the recommended compression to breath ratio? A. 15 compressions to 2 breaths. B. 30 compressions to 2 breaths. C. 5 compressions to 1 breath. D. 10 compressions to 1 breath. Answer: A. 15 compressions to 2 breaths. This question tests your knowledge of specific CPR ratios for 2 rescuers involved with an infant. The keywords 2 rescuer and infant are crucial, as ratios change based on age and the number of rescuers. When 2 rescuers are present for an infant, the recommended compression-to-breath ratio is 15 compressions to 2 breaths. This higher ratio of breaths is important for infants since their cardiac arrest is often related to respiratory issues. For instance, one rescuer would perform compressions while the other delivers breaths, aiming for 15 compressions then 2 breaths. Remember, for infants with 2 rescuers, more breaths are emphasized. Question 23. What is the most important component of high-quality CPR? A. Minimal interruptions in chest compressions. B. Administering rescue breaths without fail. C. Checking pulse frequently. D. Using an AED as soon as possible. Answer: A. Minimal interruptions in chest compressions. This question focuses on identifying the single most critical factor for effective CPR. While all listed options are important, minimal interruptions in chest compressions is considered the most important component of high-quality CPR. Continuous, uninterrupted chest compressions are vital because they maintain consistent blood flow to the brain and heart. Any pause in compressions means blood flow stops, so keeping compressions going as much as possible is key. For example, when switching rescuers or preparing for an AED shock, transitions should be as quick as possible to minimize these interruptions. Always remember, push hard, push fast, and minimize interruptions. Question 24. What is the correct technique for chest compressions on an infant by a single rescuer? A. Use the heel of one hand. B. Use 2 hands, similar to an adult. C. Use 2 fingers, index and middle finger. D. Use the thumb encircling hands technique. Answer: C. Use 2 fingers, index and middle finger. This question assesses your knowledge of the appropriate technique for delivering chest compressions to an infant when you are alone. The keywords infant and single rescuer dictate the specific method. For a single rescuer, the correct technique is to use 2 fingers, typically the index and middle fingers, placed just below the nipple line on the infant's breastbone. This allows for controlled compressions that are effective yet gentle enough for an infant's delicate chest. Imagine pressing down with your 2 fingers to about 1.5 inches deep. Remember this 2-finger technique for single rescuer infant CPR. Question 25. When using an AED, after attaching the pads, what is the next step? A. Immediately begin chest compressions. B. Deliver a shock manually. C. Ensure no one is touching the victim and then press analyze. D. Turn the AED off and on again. Answer: C. Ensure no one is touching the victim and then press analyze. This question focuses on the sequence of steps when operating an AED after pad placement. The phrase "after attaching the pads" indicates you're moving to the next critical operational phase. Once the pads are correctly applied to the victim's bare chest, you must ensure that no one is touching the victim, then press the Analyze button, or the AED will automatically analyze, depending on the model. The AED needs to detect the heart's rhythm without interference to determine if a shock is necessary. For example, the AED will likely say "Analyzing rhythm, everybody clear." Always ensure everyone is clear before analysis. Question 26. How often should rescuers switch roles during 2-rescuer CPR to prevent rescuer fatigue? A. Every 5 minutes. B. Every 2 minutes, or after 5 cycles. C. When the AED is ready to deliver a shock. D. Only when one rescuer becomes too tired to continue. Answer B. Every 2 minutes, or after 5 cycles. This question highlights the importance of effective team dynamics in CPR. The concept of rescuer fatigue is critical because high-quality compressions are physically demanding and become less effective as a rescuer tires. To maintain high-quality chest compressions, rescuers should switch roles, compressor and ventilating rescuer, approximately every 2 minutes, or after about 5 cycles of 30 compressions and 2 breaths. This rotation helps ensure that fresh rescuers deliver effective compressions with adequate depth and rate. For instance, after one rescuer has completed 5 cycles of CPR, the other rescuer quickly takes over compressions while the first prepares for breaths. Regular switching is key to maintaining quality CPR. Question 27. What should be done first if a person collapses and appears unresponsive near a water puddle with exposed electrical wires? A. Drag the person to a dry area. B. Call 911. C. Turn off the power source if safe to do so. D. Check for a pulse. Answer C. Turn off the power source if safe to do so. This question emphasizes the paramount importance of scene safety, especially in hazardous environments. The presence of water puddle with exposed electrical wires creates an immediate and life-threatening danger. Your absolute first priority is to eliminate the hazard before approaching the victim. If safe, turn off the power source. Attempting to help without removing the danger would put you at extreme risk of electrocution. For example, if it's a down power line, you would not approach until the power company confirmed the line was dead. Remember, never put yourself in harm's way when providing aid. Question 28. What is the ratio of compressions to breaths for true rescuer adult CPR? A. 15 compressions to 2 breaths. B. 30 compressions to 2 breaths. C. 10 compressions to 1 breath. D. 5 compressions to 1 breath. Answer B. 30 compressions to 2 breaths. This question tests your knowledge of the compression-to-breath ratio for adult CPR when 2 rescuers are present. Even with 2 rescuer adult CPR, the ratio remains 30 compressions to 2 breaths. This is because the critical need for continuous, high-quality chest compressions for an adult takes precedence, and 2 rescuers can efficiently manage this ratio. One rescuer focuses on compressions, and the other on breaths and supporting tasks, but they still aim for the same 30-to-2 ratio per cycle. For example, one rescuer would perform 30 compressions, then pause briefly for the second rescuer to deliver 2 breaths. Maintain this balance to maximize effectiveness. Question 29. You are performing CPR on an adult when an AED arrives. What is the proper sequence of actions? A. Continue CPR until EMS arrives, then use the AED. B. Stop CPR immediately, turn on the AED, apply pads, and follow prompts. C. Apply AED pads while CPR is ongoing, then stop CPR for analysis. D. Give 5 more cycles of CPR, then use the AED. Answer B. Stop CPR immediately, turn on the AED, apply pads, and follow prompts. This question addresses the integration of an AED into ongoing CPR. The arrival of an AED is a critical moment, and using it takes priority over continued CPR as soon as it's available. The proper sequence is to immediately stop CPR, turn on the AED, apply the pads to the victim's bare chest, and then follow the device's voice and visual prompts for analysis and shocking if advised. For example, if you're doing CPR and someone brings an AED, you'd quickly clear the area, get the AED ready, and apply it. Rapid AED use, combined with high-quality CPR, offers the best chance of survival. Question 30. What is the purpose of rescue breaths during CPR? A. To stimulate the diaphragm to contract. B. To inflate the lungs with oxygen. C. To check for an airway obstruction. D. To cool down the victim. Answer: B. To inflate the lungs with oxygen. This question focuses on the primary physiological goal of rescue breaths during CPR. The purpose of rescue breaths is to deliver oxygen to the victim's lungs, which then gets circulated to vital organs by the chest compressions. When a person is in cardiac arrest, they stop breathing effectively, so rescue breaths supplement the oxygen supply that the body needs. For example, after 30 compressions, you deliver 2 breaths to ensure oxygen is available for the blood to carry. Remember, effective breaths are just as important as compressions for delivering vital oxygen. Question 31. What is the recommended method for delivering rescue breaths to an infant using a barrier device? A. Cover the infant's nose only. B. Cover the infant's mouth only. C. Cover the infant's mouth and nose with the barrier device. D. Blow forcefully until the chest rises dramatically. Answer: C. Cover the infant's mouth and nose with the barrier device. This question specifically addresses the proper technique for giving rescue breaths to an infant using a barrier device. The keyword infant is important because their facial features require a different approach than an adult. When using a barrier device, you should cover both the infant's mouth and nose with the device to create an effective seal, ensuring that air goes into their lungs. You should then deliver a gentle puff of air, just enough to make the chest visibly rise. For example, using an infant mask, you would ensure it covers both openings before delivering a breath. Remember to be gentle and ensure a good seal over both the mouth and nose. Question 32. What is ventricular fibrillation, VF? A. A normal, healthy heart rhythm. B. A slow, steady heartbeat. C. An irregular, chaotic heart rhythm that causes the heart to quiver uselessly. D. A condition where the heart stops beating entirely. Answer: C. An irregular, chaotic heart rhythm that causes the heart to quiver uselessly. This question tests your understanding of a specific, life-threatening heart rhythm. Ventricular fibrillation, VF, is a dangerous electrical problem in the heart where the ventricles, the main pumping chambers, quiver chaotically instead of beating effectively. This chaotic electrical activity means the heart cannot pump blood, leading to sudden cardiac arrest. An AED is designed to detect and treat VF by delivering a shock to reset the heart's electrical activity. For instance, if an AED advises a shock, it's likely detecting VF. Remember, VF is an emergency where the heart can't pump, and an AED is the treatment. Question 33. What is the correct position for a choking infant to receive back blows and chest thrusts? A. Lying flat on their back on a hard surface. B. Sitting upright in a chair. C. Face down on your forearm, supported, with their head lower than their chest. D. Face up on your forearm, supported, with their head higher than their chest. Answer: C. Face down on your forearm, supported, with their head lower than their chest. This question focuses on the safe and effective positioning for managing a choking infant. The phrase, choking infant, is crucial, indicating the need for specific, gentle maneuvers. To deliver back blows, the infant should be held face down along your forearm, with their head lower than their chest, supported by your hand on their jaw and head. This position uses gravity to help dislodge the foreign object. For example, after delivering 5 back blows, you would then flip the infant to perform chest thrusts in a similar supported position. Always remember to support the infant's head and neck and use gravity to your advantage. Question 34. What is the main purpose of the recovery position? A. To help a conscious person rest comfortably. B. To prevent an unresponsive, but breathing, person from choking on vomit or fluids. C. To provide chest compressions more easily. D. To prepare an unresponsive person for an AED. Answer: B. To prevent an unresponsive, but breathing, person from choking on vomit or fluids. This question tests your knowledge of the recovery position and its primary use. The core concept is about maintaining an open airway for someone who is unresponsive but is breathing normally. The recovery position, typically lying on their side with the head tilted back, helps drain fluids from the mouth and keeps the tongue from blocking the airway. For example, if someone passes out but is still breathing, you would gently roll them onto their side to prevent them from choking on their own vomit. Remember, the recovery position is for breathing, unresponsive individuals. Question 35. If a child is choking and becomes unresponsive, what should you do? A. Continue giving abdominal thrusts. B. Position them in the recovery position. C. Begin CPR, starting with chest compressions. D. Check their pulse and call 911 immediately. Answer: C. Begin CPR, starting with chest compressions. This question assesses your response to a choking child who transitions to unresponsiveness. The key phrase, becomes unresponsive, is the critical trigger for changing your actions. If a choking child becomes unresponsive, you should immediately lower them to the ground and begin CPR, starting with chest compressions. Each time you open the airway to give breaths, look for the obstructing object and remove it if seen. For example, if you were giving abdominal thrusts and the child slumped, you would start chest compressions and look in the mouth before breaths. Remember that chest compressions can help dislodge the object. Question 36. What is the recommended compression depth for child CPR? A. At least 1 inch 2.5 centimeters. B. About 1.5 inches 4 centimeters. C. At least 2 inches 5 centimeters. D. Approximately 1/3 the depth of the chest, about 2 inches 5 centimeters. Answer: D. Approximately 1/3 the depth of the chest, about 2 inches 5 centimeters. This question focuses on the correct chest compression depth for a child. The keyword child is important because their anatomy is different from an infant or an adult. For a child, compress the chest approximately 1/3 the depth of the chest, which usually translates to about 2 inches 5 centimeters. This depth ensures effective blood circulation while being appropriate for their size. Imagine pushing firmly enough to make a difference without causing harm. Always remember to adjust your compression depth based on the victim's age category. Question 37. When providing rescue breaths with a barrier device, pocket mask, to an adult, how much air should you give? A. A large breath, filling their lungs completely. B. Just enough air to make the chest visibly rise. C. 2 short puffs of air. D. Enough air to cause the stomach to rise. Answer: B. Just enough air to make the chest visibly rise. This question assesses the proper technique for delivering rescue breaths. The critical clue is how much air should you give when using a barrier device. When providing rescue breaths, you should give just enough air to make the victim's chest visibly rise, typically over about 1 second. Giving too much air too quickly can force air into the stomach, potentially causing vomiting. For example, after opening the airway, you would deliver a breath until you see the chest gently rise, then deliver a second breath. Remember to deliver gentle, effective breaths. Question 38. After using an AED and delivering a shock, if the victim remains unresponsive, what should you do? A. Check for a pulse for 30 seconds. B. Immediately resume chest compressions. C. Remove the AED pads. D. Wait for EMS to arrive without further action. Answer: B. Immediately resume chest compressions. This question reiterates the critical action after an AED shock. The phrase, "if the victim remains unresponsive," means the heart has not started beating effectively, or the AED has analyzed and is no longer advising a shock, and CPR is still needed. Immediately after an AED delivers a shock, regardless of the victim's response, you must resume chest compressions without delay. This continuous circulation is vital to support the heart and brain until professional help arrives or the victim shows clear signs of life. For instance, once the AED says "shock delivered," you would place your hands back on the chest and start compressions without hesitation. Every second counts, so resume CPR promptly. Question 39. Which of the following is a sign of effective chest compressions? A. The victim's eyes open. B. The chest visibly rises and falls with each compression. C. Blood spurts from the mouth. D. The victim has a rapid pulse. Answer: B. The chest visibly rises and falls with each compression. This question addresses how to recognize that your chest compressions are being performed correctly. The phrase "sign of effective chest compressions" refers to visual cues that indicate you are pushing with adequate depth and allowing full chest recoil. For effective compressions, you should see the chest visibly rise with each recoil and fall as you push down. This visual confirmation ensures you are pushing hard enough and allowing the chest to fully recoil. For example, during CPR, one rescuer can watch the chest move to confirm good compressions. Remember to look for visible chest movement to ensure effective compressions. Question 40. If you are alone and an adult collapses, becomes unresponsive, and you suspect an opioid overdose, what should you do after calling 911? A. Immediately give rescue breaths. B. Perform 2 minutes of CPR. C. Administer naloxone if available and train to do so. D. Wait for EMS to arrive. Answer: C. Administer naloxone if available and train to do so. This question addresses a specific scenario involving a suspected opioid overdose. The critical clue is "suspect an opioid overdose," which brings in an additional life-saving intervention. After calling 911, if naloxone, an opioid overdose reversal medication, is available and you are trained in its administration, you should administer it. You should then begin CPR if the person is unresponsive and not breathing normally. Naloxone can rapidly reverse the effects of an opioid overdose, potentially restoring breathing. For instance, if someone shows signs like pinpoint pupils and slowed breathing, and you have naloxone, you'd administer it quickly. Remember, naloxone can be a crucial first step in an opioid overdose emergency. Question 41. What is the universal sign for choking? A. Coughing loudly. B. Clutching the throat with one or both hands. C. Wheezing or difficulty breathing. D. Redness in the face. Answer: B. Clutching the throat with one or both hands. This question tests your ability to recognize the universal nonverbal signal for choking. The phrase "universal sign for choking" refers to a widely recognized gesture that indicates someone is unable to breathe due to an airway obstruction. Clutching the throat with one or both hands is the classic, universally understood sign that a person is choking. This visual cue helps you quickly identify a severe choking emergency. For example, if you see someone make this gesture at a restaurant, you'd know they are in distress. Always look for this critical sign to identify a choking victim. Question 42. What is the recommended compression depth for an infant when using the thumb encircling hands technique for 2 rescuers? A. About 1 inch 2.5 centimeters. B. About 1.5 inches 4 centimeters. C. At least 2 inches 5 centimeters. D. No more than 0.5 inches 1.25 centimeters. Answer: B. About 1.5 inches 4 centimeters. This question focuses on the specific compression depth for an infant using a two rescuer technique. The keywords infant and thumb encircling hands technique are important because this method is preferred for two rescuer infant CPR and has a specific depth. For an infant, regardless of the technique, two fingers or thumb encircling hands, the recommended compression depth is about 1.5 inches for centimeters or approximately 1/3 the depth of the chest. This depth is effective for infants while minimizing the risk of injury. Remember that this consistent depth applies to infants, even with two rescuers. Question 43. What should you do if an AED delivers a no shock advised message? A. Remove the AED pads and wait for EMS. B. Immediately resume chest compressions. C. Check for a pulse for 30 seconds. D. Reposition the AED pads and reanalyze. Answer: B. Immediately resume chest compressions. This question addresses the appropriate action when an AED does not recommend a shock. The message, no shock advised, means the AED has detected a heart rhythm that either doesn't require a shock, like normal sinus rhythm, or isn't a shockable rhythm, like asystole, where there's no electrical activity. In either case, if the victim is still unresponsive and not breathing normally, you must immediately resume chest compressions to maintain vital blood flow. For example, if the AED says, no shock advised, you would instantly continue with CPR without hesitation. Remember, CPR is the ongoing care, even if no shock is needed. Question 44. What is the primary reason for allowing complete chest recoil during CPR? A. To prevent rescuer fatigue. B. To reduce the risk of rib fractures. C. To allow the heart to fully refill with blood between compressions. D. To help the victim breathe more easily. Answer: C. To allow the heart to fully refill with blood between compressions. This question addresses a critical aspect of high-quality CPR technique. Complete chest recoil means allowing the chest to fully return to its normal position after each compression. This is essential because it allows the heart to fully refill with blood between compressions, ensuring that the next compression effectively pumps oxygenated blood. Without complete recoil, the heart may not fill properly, reducing the amount of blood pumped with each compression. For example, imagine a sponge. You need to let it fully expand to absorb more water before squeezing again. Always allow the chest to fully recoil to maximize blood flow. Question 45. If a conscious child is choking, what is the sequence of actions? A. Call 911, then encourage them to cough. B. Administer 5 back blows followed by 5 abdominal thrusts. C. Perform 2 minutes of CPR, then call 911. D. Deliver chest thrusts only. Answer: B. Administer 5 back blows followed by 5 abdominal thrusts. This question tests your knowledge of how to respond to a conscious choking child. The phrase conscious child is choking indicates an immediate need for intervention. Similar to adults, the recommended sequence for a conscious choking child is to administer 5 back blows between the shoulder blades, followed by 5 abdominal thrusts, continuously alternating until the object is expelled or the child becomes unresponsive. For instance, if a child at the park starts choking on a piece of candy, you would immediately perform these maneuvers. Remember, act quickly and decisively in a choking emergency for children. Question 46. When two rescuers are performing CPR on a child, what is the recommended compression-to-breath ratio? A. 15 compressions to 2 breaths. B. 30 compressions to 2 breaths. C. 5 compressions to 1 breath. D. 10 compressions to 1 breath. Answer: A. 15 compressions to 2 breaths. This question specifically addresses the CPR ratio for two rescuers with a child. The keywords two rescuers and child are important because, for children, a slightly different ratio is used in a team setting compared to single rescuer adult CPR. When two rescuers are present for a child, the recommended compression-to-breath ratio is 15 compressions to 2 breaths. This increased frequency of breaths helps address the common respiratory causes of cardiac arrest in children. For example, one rescuer would perform 15 compressions, then briefly pause for the second rescuer to deliver 2 breaths. Remember, for children with 2 rescuers, prioritize a 15 to 2 ratio. Question 47. What is the purpose of performing CPR on a victim who is in cardiac arrest? A. To fully restore normal heart function immediately. B. To prevent brain damage and keep the vital organs supplied with blood until advanced medical care arrives. C. To diagnose the cause of the cardiac arrest. D. To help the victim breathe on their own. Answer: B. To prevent brain damage and keep the vital organs supplied with blood until advanced medical care arrives. This question focuses on the overarching goal of CPR. The core concept is that CPR is a temporary measure designed to support life rather than instantly cure the underlying problem. The primary purpose of performing CPR is to manually circulate blood, delivering oxygen to the brain and other vital organs, thereby preventing or delaying brain damage and buying time until professional medical help or an AED can intervene. For example, think of CPR as a bridge to definitive care. Always remember that CPR keeps hope alive until more advanced care can take over. Question 48. When preparing to use an AED on a victim with a hairy chest, what should you do? A. Place the pads directly over the hair. B. Shave the area where the pads will be placed. C. Use only one pad instead of 2. D. Place the pads on the victim's back instead. Answer: B. Shave the area where the pads will be placed. This question addresses a practical consideration when applying AED pads. A hairy chest can prevent the AED pads from making good contact with the skin, which is essential for effective electrical current delivery. Therefore, if the victim has excessive chest hair that interferes with pad adhesion, you should quickly shave the area where the pads will be placed to ensure proper contact. Many AED kits include a razor for this purpose. For example, if you see a very hairy chest, take the time to quickly clear the area for the pads. Remember, good pad-to-skin contact is vital for the AED to work properly. Question 49. If you find an unresponsive person who is not breathing normally, but has a pulse, what should you do? A. Start chest compressions immediately. B. Position them in the recovery position. C. Give rescue breaths, 1 breath every 5 to 6 seconds for an adult, and call 911. D. Go to get an AED. Answer: C. Give rescue breaths, 1 breath every 5 to 6 seconds for an adult, and call 911. This question tests your ability to differentiate between needing full CPR and needing only rescue breathing. The crucial distinction is that the person has a pulse but is not breathing normally. In this scenario, the heart is still circulating blood, but the victim is not getting oxygen. Therefore, you should give rescue breaths, 1 breath every 5 to 6 seconds for an adult, and ensure 911 has been called, until either the victim starts breathing normally or a more advanced provider takes over. For example, if someone has overdosed and their breathing has stopped, but you feel a pulse, you would focus on delivering breaths. Remember, if there's a pulse but no breathing, provide rescue breaths. Question 50. What is the recommended compression depth for infant CPR? A. At least 1 inch 2.5 centimeters. B. About 1.5 inches 4 centimeters. C. At least 2 inches 5 centimeters. D. No more than 0.5 inches 1.25 centimeters. Answer: B. About 1.5 inches for centimeters. This question assesses your understanding of proper chest compression depth specifically for infants. The keyword infant is crucial, as the depth differs significantly from adults and children. For infants, compress the chest about 1.5 inches for centimeters deep, which is approximately 1/3 the depth of the chest, to effectively circulate blood to their small vital organs. Imagine pressing down just enough to visibly move the chest, but not so hard that you cause harm. Always remember that infant CPR requires a more delicate yet firm approach than adult CPR.